All right, so today we're going to dive into something pretty big in the world of public health.
Yeah, this is a significant one.
There's been a lot of news about it, and, we've been digging through some reports. We'll call it pasted text for now.
Yeah.
And basically what's going on is that a whole bunch of states have decided to sue U.S. Department of Health and Human Services, it's HS, over some pretty major funding cuts.
Yeah. And when I say a bunch, I mean we're talking 23 states plus D.C. all coming together to take on HHS and Secretary Kennedy.
So, our goal here is to really break down this legal battle for you. What are the big arguments? What's at stake? And, how could this all potentially impact all of us down the road?
So the thing that really jumps out right away is just the number of states involved in this lawsuit. I mean, 23 states plus D.C. That's a pretty big coalition taking on HHS and Secretary Robert F. Kennedy Jr. And they're all saying that these cuts to public health funding are not only unlawful, they're actually going to hurt people.
Yeah, I mean, we're talking about a $12 billion cut to public health funding.
Huge.
That's a massive number. So what exactly are these states saying is going to happen as a result of these cuts?
So the attorneys general from all these states are painting a very serious picture. They're saying that this is going to stop the progress that's been made in fighting the opioid crisis. It's going to make the mental health system, which is already struggling, even worse. And it's going to put a huge strain on hospitals. These are all really important public health challenges, and if you take away a lot of funding, all of a sudden things could get a lot worse.
And it's not just theoretical, right?
No, absolutely not.
I mean, Letitia James, the Attorney General in New York, she specifically said that her state alone stands to lose more than $400 million.
Yeah.
And that really brings home the scale of these cuts for individual states. I mean, think about that. $400 million just gone from one state's budget.
Right. And they're trying to get a temporary restraining order to stop these cuts from happening right away while the whole legal battle plays out.
Okay, so we've got these states facing these massive potential losses, but what's the federal government side of the story? I mean, why are they making these cuts?
So Secretary Kennedy has said that they expect HHS to have about 10,000 fewer full-time employees, and that's on top of people who've already left or been let go. Their argument is basically that the department can do its job better and more efficiently with fewer people.
So where exactly are these cuts actually happening within the public health system?
So we're seeing cuts across several important divisions within the CDC. This includes the National Institute for Occupational Safety and Health, which does a lot of work on workplace safety. Then you've got programs that work on preventing injuries, programs aimed at reducing smoking and its health effects. There's violence prevention initiatives and even programs focused on HIV. So it's a pretty wide range of areas that are being affected.
And the reaction from people within these agencies?
It's been strong. One FDA employee was quoted as saying it's a bloodbath.
Wow.
So there's a lot of concern and anxiety about what these cuts are going to mean.
It sounds like it, but HHS does have a reason for these cuts, right? It's not just arbitrary. It has to do with how money was spent in the past, right?
Right. They're pointing to the roughly $11.4 billion that was given to states and communities to deal with the COVID-19 pandemic.
Yeah.
Their argument is that the pandemic is over, so that money shouldn't be spent on something that doesn't exist anymore.
Okay, so they want to use that money for something else then.
Exactly.
Where are they saying these new priorities are going to be?
So they're saying they're going to focus more on chronic diseases and President Trump's Make America Healthy Again agenda.
But the states are pushing back on that, right? They're saying that that money wasn't just meant for COVID, it was meant for public health more broadly.
Absolutely.
Yeah.
The attorneys general are saying that this money was intended to support the public health system as a whole, not just as a temporary response to COVID-19. It's like they're arguing over what this money was really supposed to be for and how long it was supposed to last.
And there's also a legal argument here, right?
Right.
Something about the Constitution.
Yeah. This is really important. The states are saying that the administration can't just take back money that Congress has already approved. They say that it goes against the Constitution because it takes power away from the legislative branch, which is the one that's supposed to control federal spending.
So it's not just a disagreement about public health. It's a disagreement about how our government is supposed to work.
Exactly.
So to sum all this up, we've got a major fight happening between the states and the federal government over these public health funding cuts. The states are saying that these cuts are going to hurt people and that they're not even legal. On the other side, HHS is saying they're just being responsible with taxpayer money and shifting resources to where they're needed now that the pandemic is over.
And the really important question here is what happens next? I mean, what happens if the states win their lawsuit? What does that mean for the future of public health funding? What does it mean for the balance of power between the states and the federal government? And on the other hand, if HHS gets its way, how is that going to change things for public health on the ground in your community? I mean, could it mean fewer services? Could it mean less support available for people who need it?
And that's really what we all need to be thinking about here. This whole situation could have a real impact on our lives and the health of our communities.
And that's why it's so important to understand what's going on and to stay informed about how this all plays out.
Thanks for joining us for this deep dive.
You got it.
And we'll keep you updated as this story develops.
Absolutely.
Until next time.
See you then.